So I appreciate you coming today. How are you?
Good, good. Thank you.
So you're going to be giving us some information that's really going to help educate our clinical leaders across the company. So with your permission, I'm going to go ahead and get into the questions.
Okay.
All right, so we know a little bit about what happened that day, the incident. Can you tell me about that day from your perspective?
That day was, I think, one of the worst days throughout my whole nursing career. I mean, I kind of knew when I walked in that he was a little bit off,
Okay.
but as the shift went on, I just knew it wasn't going to be a good day, a good shift, you know. But it was a tough shift to work.
Thank you. So I want to kind of go to when you called the paramedics and they arrived and you handed over care to them. So tell us about how you were feeling at that moment.
Well, at the moment, I felt like it was forever. You know, just having to call for 911 and do compressions at the same time and give oxygen. Hearing where he lived, hearing them go around but not coming in the door, it just felt like, are they coming? Are they going to be, you know, it just felt like it forever. It was a really, really long, they said they'll be there any minute or they're right at the door, but it just seemed like they weren't there. But time goes really slow, I think, in that situation. So.
And can you talk about what occurred when you arrived at the hospital?
Well, when I followed them to the hospital, I parked in the parking lot. And at that time, I spoke to the primary nurse who had trained me on the case.
Okay.
And she informed me that he had passed away. So not knowing the parents as well as she did, she advised me not to go in. And I didn't know I basically was frozen and very upset sitting in the parking lot, not knowing what to do. So that's when I called Beata and called for the supervisor. And I left at that time waiting for a call back. I'm driving down the parkway, and the supervisor called me back. I went to the side and talked to her, and you know, she said I didn't have to go in, but I felt like I really wanted to go in and follow and be with him the whole time. But knowing how the parents were in this particular situation, it would have been not good for my safety if I went in.
So you wanted to go in, but you were being
I wanted
respectful.
to go in, but I think that I would have gotten injured if I did. So, yeah.
And you went home.
I went home, yeah.
And talk about how you're feeling when you got home.
I was really upset, but I didn't know what to do. So I did speak to Marilyn, the supervisor, and she basically talked. So I was getting upset, but kind of talked to me and kind of tried to, you know, be there for me when it was a really, really bad shift. But you're kind of like alone because, you know, you're in the home alone doing all that you can do. Then you try to go to the hospital and you're by yourself and you don't know if you should go in. Then you go home and you don't know what to do. And there really isn't much to do, but you're thinking to yourself, did I do everything I could do? Did I do everything the best I could? And even if you do everything that you can do, sometimes the outcome is what happens. You know, these patients in the house a lot of people think of home care as, oh, it's an easy job. But it's not. It's not as easy as what people think. You know, these kids I do pediatrics and I do adults, and these patients, our clients, are really, really sick. And that's why they need nursing. But this gentleman in particular was a very, very, very sick man. So, and I think at the time the parents didn't think he was as sick as he was, but he was not doing so well for a while. So,
Well, thank you. And so I don't know, did you sleep at all that night?
No. I basically just kind of walked back and forth outside my house or inside my house, like thinking, should I have gone in? Should I still go back? Maybe I should go back. and then I spoke to Marilyn, and she said, it's not a good idea to go in. But the person that really made me feel like I shouldn't really go in was the primary nurse. She was there during the day and has been with the family for a long time. But to me, I listened to her, and I said to myself, like, maybe I should have went in, and maybe I should have went to the funeral afterwards. Maybe I should have did this, but it should have really came from the supervisor of what to do.
Yeah.
And
So you didn't sleep, and
No.
you're next day still feeling it.
I continued working for a while after. I didn't take any time. I've only been with him. I was only with him for 16 hours of orientation. Then I had only one shift with him. So the one shift was only a couple of hours. So at first I wasn't so impacted as much as everyone else who's cared for him for so
Right,
long.
right.
But then it hits afterwards.
Yeah. And that kind of leads me to the next question. What type of support, were you offered,
Well,
to help
they
you
did.
deal with the situation?
Oh, well, besides talking to the supervisor and everyone in the adult side of Beata were, when you walked in, they did, do you need anything, or I'm here if you need to talk. But they did offer grief counseling. At first, I didn't think I needed to. And but then afterwards, I did take that opportunity to speak to someone. So it was
You didn't think you needed it at first?
not at first, because besides working in home care, I do have a lot of experience working in the hospital, and I've seen patients pass, and I've dealt with a lot of it. But I guess it's different. You don't realize how different it is when it's just you and the patient, and you don't have another team with you. So it kind of hits you a little bit differently. So
And what made you take the grief counseling?
I think it was because I felt like I really couldn't talk to anybody about the situation because of the HIPAA law and confidentiality. You can't just go around talking to your friends about it or family members or other nurses because you have to keep that. So I felt like I had to keep everything in. I felt like I really couldn't talk to anyone about it. And then when the time came for the interviews and stuff like that, I didn't know if I could even say anything, so I kind of held everything in. So,
I get that.
yeah, which is not good. You should really take the grieving counseling and talk to someone. You might not feel like you're really. It's good to get it out. It's not good to hold it in. It's not good at all.
And you said you've dealt with adverse situations and clinical situations in the
But
hospital.
in a
with this.
hospital setting, and I thought that I'd be okay in this situation. But like I said, it's different in home care because it is just you, and it's you with just, it's not like you have a doctor and you have another nurse, or it's like when you're doing, when somebody goes into a code or they start to go bad, one nurse usually writes down what you're doing and, what times, and I really couldn't do that in the middle of doing compressions and getting an airway, calling the paramedics. I basically was writing on the sheet. I didn't have time to sit there and document. I had to write down exactly everything that was happening. So that's normally in a situation at a hospital setting where you have more than one person doing different jobs during that. So that's why it was tough because it's just you.
Yeah, so it's that.
And
Being
you got to remember
alone.
everything, and you just didn't. It's hard. It's tough, so.
It sounded like your training kicked in.
Yeah, it did. I mean, writing on a sheet or writing on just a tissue or something or anything, or even writing on your hand. It's from the emergency room experience. You don't have time to get the chart and write everything down, and things happen so fast that you just have to. I'm glad that I did have the emergency room experience. I really did.
Yeah. So, kind of want to shift to something a little bit more uncomfortable. So, how did you find out that the parents felt that you did something wrong?
Not that night, but afterwards, I think the next day or so, the primary nurse calls me again and told me what they were saying, and then the office supervisor told me what they were saying. So I didn't really hear it directly from them, but then I said to myself, can't imagine if I did go in, what they would have said.
How'd that make you feel, knowing that?
I was upset. I was really upset.
Yeah. And how did their allegations impact sort of the way you practice as a clinician now?
Well, at first, you kind of lose confidence in like yourself. You kind of feel like, you start checking everything. You start checking to make sure you did everything the correct way, and you did
Right.
everything, and everything you were supposed to do. But sometimes talking to other people makes you feel like, you did what you could do. You did everything you could do. And working a little bit after that, I did take some time off. And I think that was the best thing I could have done, was take some time off and from nursing itself, and just stay home with family and kind of regroup after all that, because that was a tough thing to deal with.
Yeah, I can
That was
imagine.
tough,
How
But
much time did you take off?
I think I had 4 months I took off. Yeah, but I mean, I worked a little bit after that, but I didn't decide to take off in November. So
Okay.
I had to. It was getting to be, But now that I'm back, and when it comes to me because I also precept on the pediatric side.
Okay.
So, and when I came back, I was on the adult side with a trach vent. And if I feel that nurses don't know what to do, or if they're uncomfortable, if I see that they're uncomfortable with a certain skill, I have to bring it up to the supervisors. And I'm expecting that the supervisors, go out there and see them with the client and watch them do. You just don't just sign off just because you need somebody to work the shift. Like,
Yeah.
I want to make sure that everyone's getting the best, nursing that they can.
And we appreciate that. We really do. So how are you today?
I'm good. I know this is something that I'll never forget,
Yeah.
and this is something that I'll always probably bring up in the future or remember. But it was definitely as a learning experience. But there was a couple things that I hoped could come out of it. Like, for instance, on the adult side, a trach change is once a month or whenever they need it. But on the pediatric side, it gets changed more frequently. So, but you have to go to a trach change. You have to go to a circuit change. You cannot work on, individually until you get all these things done. And I feel like the adult side could do that too, because, yes, they've had the trach for a longer time, but you only have a certain amount of minutes to get an airway. And I would feel more comfortable working on a team that nurses did a trach change or
Right.
were there, and know what to do in an emergency situation.
So you kind of teed up my last question perfectly. As someone who's just been through an adverse incident, if you could offer advice to others, what would it be?
Well, one advice is that if you're not the supervisor, you have to know your role.
Okay.
And to me, you should know your role, and you really shouldn't cross boundaries, because it makes it difficult for other nurses. But one, you need to know your role. Like, if I'm not the supervisor, so I need to bring things up to the supervisor.
Right.
But my expectations should be that the supervisor follow through, and get kind of like a feedback. We're all a team, even though we're working individually in the homes. It's a Bayada team. It's not just you.
Right.
And if you feel that something needs to be addressed or something needs to be changed, don't feel afraid to say it, because if I walk into a home and it's another trach vent client, and on this particular client there was no emergency bag. So when I came into the client that had passed away, the second day I was there, I was like, "Where's the red bag?" And they said that nobody got it, or this. You need that bag. That's a very important bag. It's got all the trachs in there, and has everything to where you can just grab and go. Working out of a Ziploc bag, to me, is not very, very professional, and you're kind of unprepared for an emergency. So certain things, if you think things can be better, or how you can make working with that client a lot easier, you should speak up. You shouldn't just do your job and go. But you should also feel like your voices are being heard. So.
Thank you.
Yeah.
Well, we appreciate you taking the time to share this and being very honest and real with us. It makes a difference, so thank you.
And thank you, and you're welcome. I'm sorry, you're very welcome. But I also want to say, too, as an employee, if any other employees feel that you are going to feel nervous, you are going to feel scared, but you need to just do the best that you can do and be confident in your skills. And if you do feel like there's a certain part of your skills that you need more work in, Bayada does offer, helping with that. That you can always ask for more time on orientation or in the skills lab. You don't have to feel like, you should always say, "I haven't done this in a while. Can you watch me do this?" You shouldn't be afraid to ask them.
Yeah, good
So,
advice.
that's-
Good advice.
something
Anything
I
else you
wanted
want
to
to?
say too.
Anything else you want to add?
No. Besides that, no.
I really appreciate it.
Thank you.
Thank you for your time.
You're welcome.
That was great.
Mhm.
Thank you so much. I have three things.
Okay.
The first thing is, I think it would be very powerful if you did take them through that moment when Ian coded.
Okay.
What were you doing? What happened? What were your steps? Because you have, this is 100% clinicians in the room. You want to bring them to that moment.
Okay.
So if you could just ask that question again and
Thank
just
you.
take through the moment. The other thing is, I think it's important to recognize that your journey was very tough. You had
Yeah.
accusations made that were not accurate. It resulted in you being investigated by the State Board of Nursing.
Mhm.
And I think that's a very powerful piece, Jackie, that
Right.
I don't want to lose that piece. And the other thing, Mark, is there a way to frame a question so that Jackie's giving advice to the clinical leaders about how
Good point.
a clinical leader can support an
Mm.
employee who goes through a devastating situation as Jackie went through?
I think so.
That's the lesson. I
How we
want
could have
you to
better
get.
helped her
Yeah.
Do you want to write it down?
and those like
Lauren?
her.
Yes. I'm not going to remember it. I think I got it.
Powerful stuff, powerful.
Yeah. Yeah, I didn't even think about going through everything that happened that day,
Yeah,
and
I think it's,
that would be, yeah.
yeah, it's important.
I think for the people watching, it's going to be important to get a true picture of how tough this
Yeah.
kid was.
And your best practices. You did a lot, you did everything right.
Right,
So you want
Right.
to take them
Yes,
through
you
that.
wanna take the credit for that, too.
Right.
yeah.
You want me to take the pen back?
Yes. Thank you. So we'll actually start with,
I say these two, because maybe you want to do close up.
No, I am. I mean, it's already done. I'm just saying
I
that
do
I
have
like
some
that
more,
sign.
yeah, I do agree with you on that one. I do.
But this just gives them more visual.
Yeah.
so we'll start,
Good job catching these.
we'll start where the, what happened,
On that shift.
that day,
Mhm.
so just take your time. He has plenty of tape to get that, so. All right, so we know a little bit about, I'm sorry, were you
You're good.
rolling?
Yeah, you're good.
Okay. All right.
I didn't stop.
All right, good. So we know a little bit about what happened that day with the incident. So I want you to take your time. Tell me about that day from your perspective.
Well, as soon as I walked in, I did speak to the parents and get a report. And they did report that he didn't have a nurse all day, but that was from another previous, I believe it was from another nursing agency, wasn't able to staff it. So they were behind on his feeding and his medication. And as soon as I came in, I saw that the feeding was running faster than what the doctors ordered. So I had to change that to what the doctors ordered. And I started going on with his care. And immediately he started vomiting. And the parents came in, and the parents kind of took over and started doing a lot of suctioning, and a lot of deeper suctioning than what we would normally do. And they were kind of arguing back and forth about doing a trach change in the middle of the client, vomiting a lot. And I'm trying to get him as stable as I can. And it's hard because, like, you're trying to take care of the client, but you have the parents, and you're right in the middle of the parents arguing, but you're trying to focus on the client. And that was a difficult part. But once we got him, like, all cleaned up and settled down, he didn't need a trach change. Everything was good. I did ask if, I suggested that maybe he would go and get checked out to make sure he was okay. But the parents said, no, it happens to whenever there's a new person. That happens a lot. He gets like that. And he's fine. So I proceeded to continue with his care. And the parents decided, now this is my first shift after 16 hours. So it's my first time with him. And the parents were comfortable enough to leave, and they left to go somewhere. And I don't know exactly how long, because I don't have my papers in front of me, but probably about an hour after that, he started to look different. He started to act different, and his heart rate was really high and then started to go really low. And his airway was good, but I knew his heart rate wasn't doing so well. So besides looking at the pulse ox, you also have to, listen to because it could be the machine, it could be something wrong, but I knew something was not right. So I had to get out all the emergency stuff ready. and I had to run to open the door. Now, you're trying to take care of a client who's not doing so well, but you got to go open the front door. So you got to unlock the door, open it up. You're trying to be on the phone with the paramedics, and I actually lost the first call. So I had to call again, and that's when I had to start doing compressions with him, to him, and also try to get an airway. And on this particular client, the way you would do it, it wasn't like a normal airway. He had a customized trach, so he was very contracted. So it's easier to do if I'm standing up, but like you trying to do compressions and then you have to hold him a certain way just to get the airway in. And that was one thing that, I guess that was tough because I'm trying to still stay on the phone and give information of what's going on. And I'm trying to count, give a breath, count, give a breath. And like I said, when all that happened, well, as soon as the paramedics came, they like took over. And I talked to the police officer was there. The paramedics were trying to get an IV access with him to give him emergency medicine. And they were still doing compressions and taking care of him. But it was hard because they couldn't get anything. They couldn't get any lines. They couldn't get anything going. So they started to transport him out. And as I can see him going, I could see on the heart monitor that he wasn't doing well. And I could just see that. I just felt like it was going to be not a good outcome. Yeah. But once he left, I just basically froze, and the police officer stayed with me and made sure that all the doors were locked, the lights were off. I took his chart, and we left. He made sure the front door was locked, and he said, "Are you going to be okay to drive?" I said, "Yeah, I have to go. I have to go with my client. I have to go." And I went in the car, and, I made the phone calls to the parents. I called the parents so many times, and nobody picked up. And I didn't want to leave the message on a voicemail that your child's not doing so well. You really need to answer your phone. You really need to get here. You really need to see him. So I called the mother's phone. I called the father's phone. I'm trying to call Beata. I'm trying to call these people, and I'm crying in the middle of it. But there's times where, it's because the adrenaline rush, and then it just kind of stops. And you're in the car, and you're just like, what do I do? What do I do? And I said, "Oh, this is what I have to do. You have to talk to the parents. You have to let the parents know. You have to let Beata know. You have to let the supervisor know. There's a lot of people that have to be informed that your client's transported to the hospital." And a lot of the phone calls, they were really close to the hospital. So a lot of phone calls I made in the parking lot, just frozen. I didn't even know, at that moment, what do I do? I just sat there with this chart on the phone and didn't know, what else can I do? Should I go? Should I stay? But it was a difficult part.
So, you share with me that the client ended up, client did make it, and you later found out that the parents thought you were to blame for that. So I want you to talk to us about how that made you feel. And
Well, from what I heard, they, wanted to know if I changed his trach, and they didn't know where his other trach was. And I was trying to explain to everyone that in the emergency, everything was piled on him, like in the sheets. So during transfer, everything went. So I know I did not change his trach. He didn't need a trach change. I think they think that's what they really thought. That was a problem with his airway. But it was more of his cardiac status was declining, and then his airway started to decline too. But at first, it was not his respiratory issues that made him pass away, but it was more cardiac. So the parents were accusing me of, I guess, not doing good care with him, or not, taking care of, an emergency situation. Maybe a trach change would have been something. And they asked if I did change the trach. And to me, it was like, if the airway's good and you're getting your breaths in, you really shouldn't change. You shouldn't, change the airway, because you may not be able to get another one in.
Right.
So if you have a good airway, you got to keep it.
Right.
And I think that was one thing that they just kept asking. And I was like, no, I'm not going to change a good airway and take that out and not get another airway in, But a lot of stuff I heard, they didn't directly say it to me. So,
I guess what was the impact on, your judgment being questioned on you as a clinician?
well, at first I was really upset because I've been with the company for a while, and I have worked with many clients, and I really felt like I'm doing a good job, and I also precept on the pediatric side, though, for trach vent. And, basic right now. And then I have done trach vent. And I always ask questions. I took the class, like I try to, do the best I can. And I'm always prepared for an emergency situation. Even before this, I've always made sure everything was ready to go, because that's just from my previous experience working in the hospital. That's how I was trained. So it made me think, like, am I doing everything the best that I could? Did I do everything how I was supposed to do it? Did I do it right? And it was hard at the time because, like I said, there's not really a lot of people to talk to. It's not like you have a group of, it's kind of hard for me to relate this, but like when you're by yourself, it's different than when you have, like, say 4 or 5 people working on a code on a patient in a hospital where you all can talk about it afterwards.
Right.
And but in home care, it's not like that at all.
Yeah.
It's just you, yourself, and like the books and talking to the supervisor.
Yeah.
And that's it. There really isn't much.
I know we had already talked a little bit about grief counseling, and you end
Mm-hmm.
up taking that. So I'm just curious, what would you want the clinical leaders in the company to know about the importance of supporting the clinician when they go through an adverse incident? like
At
this
first,
one?
I didn't take the counseling, and I continued to work. But after many interviews with the Board of Nursing, with the legal staff of Bayada, and the supervisor, and a lot of people asking me, because a lot of things at first didn't come up, like, you have my nurse's notes of what happened, and then you have an EMT, and then you have the police officer, but we didn't have the paramedic report.
Right.
And to me, I was disappointed that they were taking, Bayada, I'm saying, was taking just what they had, and which I understand, but they didn't have the paramedic report. And to me, an EMT and a police report is not going to be as in detailed as a paramedic report when it comes to care. So I did have to not work for a week until they figured out what was going on. And I did hear that a lot of people did speak good, about me, as a nurse, which I was really happy to hear. But I was kind of like at home, like, well, wait a minute. I did everything, policy and procedure. I did everything that you told me to do. Like, I have all the books on trach vent. I went through everything. I did everything step by step, and now I'm home, and I'm feeling like I could lose my license, or I could be sued, or there was I was very upset. I was very, very upset.
So it sounds like
And
the
then when I
sense of
speak to the
isolation.
supervisor, she was like, you should get an attorney, you should get a lawyer, and I'm like, wait a minute, what do I do? So I don't know. I didn't know what to do at the time.
So your advice to clinical leaders would be, is it around communication?
More,
or-
yeah, and there has to be more communication. You just can't send someone home and say, well, we'll just call you when we get more information and know what to do. That I understand on the legal point of it, I understand, but when it comes to the nursing supervisor, the one, she was, it was only the experience that I had. This is the only one experience that I had in home care. So what she did, I thought was good. But looking back on it, I wish that, like, at least, call more and ask if I'm okay, if I need anything, or do you need to talk about anything? Do you have any questions? And when I had questions, it was different answers from different people, and that made me even more, upset. So.
Get that. Any other kind of final thoughts or comments related to what you would want our clinical leaders to know about better supporting people like you who go through these incidents?
Just be there as much as you can. And another thing is, for the office staff and the supervisor, is when the client passed away, the next day, only the day primary nurse did go, but the other people didn't go. So that also looked bad with the parents.
To
They
the
were
funeral.
upset. Yeah. No, besides, I'm talking about like the day or two after.
Gotcha.
No one from the office, came and talked to them. It was only really the primary nurse who came back and helped, clean up his room and get him ready for a funeral and help pick out. And to me, that really wasn't her job to do, but she chose to do that. But that made it worse, I think, because it looks bad on the company when nurses cross those boundaries and they get close and really close with the family members. It looks bad on everyone, not just me, the supervisor, the company. And I think that has to be addressed. And that's not just in this case and with this particular nurse, but I've seen it frequently, and especially in peds. And that's something that I would definitely, that has to stop, because it does look bad on the company. And like I said, the nursing supervisor or the director, it looks bad for everyone when nurses cross boundaries like that. Because they feel like, well, how come the staff did? How come the supervisor didn't come? How come the director didn't come? This client's been with Beata, from what I hear, for many, many years.
Right.
And not to have anybody come afterwards to talk to them, I think made them even more upset. So, which I guess was more upset with me, too, so. I personally haven't talked to them since then. I was informed not to, and I think that's the best. And staff members, if it happens to them, they should listen to that.
Right.
Do not contact the family. Don't go over there. In this particular incident, I didn't go to the funeral. I wish I did go, but you can kind of grieve in your own way. But listen to what the supervisor says, and hopefully the supervisor can definitely learn from this about being there, and you have to kind of go and talk to the family afterwards. You just can't wait until the funeral, because they are upset.
Thank you.
You're welcome.
Appreciate your time.
Thank you.